cannot look at COVID as a moment in time, as a short incident or issue. We've got to look at the long COVID, the long term effects, and we've got to look at how do we prepare for that as communities, but also as a health workforce. What does that look like? What is the research that's required to actually understand, and how do we actually respond? Everywhere we go, our senior management staff are talking about long COVID. It's something that's real. But I must say, it's taking people some time to be convinced. And so if we've got policymakers that are not convinced of the research, then it will limit our response to future protection and planning. So what does a 2030 pandemic plan look like? I think we've got to take in consideration all of long COVID, all of preparedness response, healthcare team. It scares me. How do I protect my mokopuna for their future if I'm feeling that we're not being listened to now? So it's right here and now that's a really critical turning point. We've got to make sure that every piece of research that's coming out is put on the table for discussion. We've got to ensure that nobody's left behind in the planning of this pandemic, so that everybody's represented and part of that discussion, and it's something that is fed back and the community is involved in this. We can't send messages about we're all in this together, we're a team of 5 million, and then only 30 people get to determine the outcome for the 5 million. We've got to make sure that everybody is invested to change and what change looks like. At the end of the day, we've all got parts to play in how we protect ourselves. This is not the time to be conservative or complacent. This is the time to really challenge to the outsides, and hopefully we can change some of the middle thinking and ground. I want to make sure that my mokopuna are protected against any future pandemics as best we can. And at the moment, there are significant gaps in our legislation and the way that we respond and the way that we're transparent and prepared within district health boards, community and other services. And there is gaps in the way that we legitimately look at the research and how we prepare for that and have that honest debate. We can no longer think that one size fits all. So planning for 2030 requires us to be brave in 2020. So ensuring that all the levers are in place, the challenges are made. We've got a lot of work to do right here and now to prepare us for 2030.